In recent years, youth mental health, specifically adolescents, teens, and young adults, has increasingly grown more concerning. The number of adolescents reporting poor mental health is increasing. This can be a direct cause of the recent COVID-19 pandemic. In an article focusing on children and teen mental health, they said there had been an increase in rates of sadness, hopelessness, and suicidal thoughts. The source of said increase in emotions can be attributed to social isolation, academic disruption, loss of caregivers, job, loss of parents, physical and slash or emotional abuse. These are all direct outcomes of COVID-19. During COVID-19, social isolation and academic disruption impacted children and teens. It may have worsened a child/teen's social skills with new friends and made them feel more isolated. The academic disruption impacted this whole generation for the worse, as it was a moment that paused the brain from learning. Even colleges made the SAT or ACT optional due to the academic disturbance in the lives of the new generation. The feelings of persistent sadness and hopelessness and having thoughts of suicide and such like behaviors have increased by about 40% among young people, according to the Centers for Disease Control and Prevention's (CDC) Youth Risk Behavior Surveillance System. Youth mental disorders being more prevalent than society may think. Globally, 1 in 7 10 to 19-year-olds experience a mental disorder. Suicide is the third leading cause of death among 15 to 29-year-olds, and anxiety disorders are common among adolescents and can involve panic or excessive worry. It is estimated that 4.4% of 10 to 14-year-olds and 5.5% of 15 to 19-year-olds experience an anxiety disorder. Depression is estimated to occur in 1.4% of adolescents aged 10 to 14 years, 3.5% of 15 to 19 years, 0.1% of 10 to 14-year-olds, and 0.4% of 15 to 19-year-olds who struggle with eating disorders and can be associated with suicide or medical complications. In 2023, 2 in 10 students, 20%, seriously considered attempting suicide, and nearly 1 in 10 students, 9%, attempted suicide. Why is this important? Why should we care about these statistics? Because this is the future generation. The generation who will lead and make change for many future generations. But how can we make a change? How can we help? Well, there are already ways being made to help. For example, psychologists are making it a goal to equip schools better to support student well-being on site. There are many prevention strategies as mental health is made aware across schools and communities. Building strong bonds and relationships with adults and friends at school, home, and community can provide a sense of connection. The feeling of a connection is important because the youth needs to know that someone cares about them and their well-being. Schools can implement strategies and approaches that can help prevent mental health problems and promote the positive behavioral and mental health of students. Schools can help students cope with emergencies and their aftermath. Promoting mental health, like helping students feel connected to school and family, helps prevent a range of negative experiences like drug use and violence. Psychologists are also building training programs to help teachers and other school staff create supportive classrooms and aid students who are in distress. Classroom-wise, well-being information and strategies for educators, developed by the Mental Health Technology Transfer Center Network and the University of Maryland's National Center for School Mental Health, NCSMH, is a free, flexible online course and resource library that draws on psychological research on social-emotional learning, behavioral regulation, mental health literacy, trauma, and more. Another resource made to help the students themselves, the National Child Traumatic Stress Network, NCTSN, created conversation cards to equip kids with basic skills for talking about suicide. Youth mental health is a growing concern that needs more awareness, more resources, and more people behind it to make a change. We hope that this film has taught you why we need to make an effort for the youth and students who struggle with mental health. No one is alone, and we support you.